This edition of Wellness Wednesday is brought to you by Uxbridge Physiotherapy, a private physiotherapy rehabilitation clinic providing quality care since 2002. Located in downtown Uxbridge, the clinic offers a qualified and dedicated team to help get you moving and feeling better. After completing a comprehensive biomechanical assessment, the team of healthcare professionals will determine the appropriate treatment plan for you. And joining Scott Campsall and myself, Scott Campsall from Makami Kai, is Nicole Igel, a registered physiotherapist at Uxbridge Physiotherapy. Good morning, folks.
Morning, Dan.
Good morning.
Yeah, so the clinic is back open. A little bit of a transition, I would think. Nicole, you guys opened your doors, June 1st after getting the approval?
Yes, that's right, Dan. I think it was after you had Jody on your last episode.
Yeah, actually, I think it was like the day before or even the day of, and all of a sudden the province went, oh, by the way, you guys, you can open up. And we were talking about the transitioning and how quickly you had to do those things.
Yeah, so Jody was quick on the go there, and we got everything up and running pretty quickly. So the plexiglass in the front and all the sort of standard checks, the COVID screening when you first come in, temperature checks, everyone's staff and patients are all do a temperature check. And then everyone is wearing masks and doing the strict hand hygiene. And we've also had to sort of change how we practice a little bit in that we're spacing more time in between clients so that we can do the proper sanitization in between clients and there's a minimal overlap. And we have less staff working every day just to make sure that we minimize, too much direct contact.
Yeah, and I know Jody was saying that day when we were talking that she had all this in place. So when the approval came through, you guys were ready. But she said that, and she explained it, that you use more hands-on. And I was trying to figure, well, that's kind of what you guys do. But she was saying that sometimes you use an elbow or something like that, and you get away from that and you use more hand techniques.
Right, yeah, no, so, we still do all the other stuff like education and exercise, and we're still offering the virtual platform as well as an option for people that don't necessarily need the hands-on. So we're trying to minimize the amount of one-on-one contact that is absolutely necessary, but some people still need that and require that. Just ensuring that we're using all the proper methods to minimize the risk of any sort of exposure.
And you guys do specialize in some areas, and that's why we've got you on today. You're talking about pelvic health. I'm going to be honest, I never knew that was a thing, pelvic health. I would think I probably fall into a category of a lot of people. Would I be correct in that?
Absolutely. You're not alone in that. It is a little bit of a more specialized area. It has really sort of grown over the last 10 years.
What does it mean, pelvic health?
Yeah. So pelvic health physiotherapy is really the assessment and treatment of different conditions that involve the pelvic floor or any symptoms that can come up in that area. So the pelvis is really the base and the bottom of your body. And it is, like any other part of the body, it is comprised of bones, joints, muscles, ligaments, and nerves. And any of that stuff can have a problem with it, just like, in your shoulder. And so that needs to be addressed and dealt with. And
we're not just talking about sciatica. I mean, I know that there was a list here that you'd sent. We were talking about bowel and bladder incontinence and things like that?
That's correct. So so people will have problems with leaking, either bowel or bladder, so that's the incontinence portion of it. Some people have issues with painful intercourse, male or female. There's also chronic pelvic pain issues. So people who have had a diagnosis of, say, irritable bowel or interstitial cystitis, bladder pain syndrome. We can also help people who have had a surgical procedure either in the abdominal region or they've had a gynecological or a urological surgical procedure. So for men, for instance, if they've had a prostatectomy, a lot of them post-prostatectomy will have issues with incontinence and erectile dysfunction. And so we can certainly help with that.
Is that how usually people come to you? Is it usually doctors that refer them to physiotherapy, or is it more along the lines of, I wonder this, like when Dan and I'm confessing the same thing. Like, you don't give a lot of thought to pelvic health. So if I had like something wrong with incontinence or bowel problems or something like that, like I wouldn't necessarily think, I should go to the physiotherapy clinic. So what's the usual case scenario, I guess, of somebody finally coming to you for this kind of treatment?
Yeah, we get people referred to us from different resources. So absolutely, doctor referrals. This is an area where, unfortunately, people will often suffer in silence for a very long period of time, thinking that, this is normal. We've sort of normalized, you've had a few babies, you're leaking, that's normal, get on with it, or we don't talk about it because we're embarrassed, especially men, they're not very comfortable talking about if they have an erectile dysfunction. So often this goes on for a very long time, and then they may mention it in passing with the doctor. And they'll often have maybe also not received very great treatment, or they'll have tried different things and it's just not getting better. So people are becoming more aware that pelvic health physiotherapy is out there and that it has been proven in the research to be extremely beneficial and helpful. So we get referrals from doctors. We get some people also, it's just word of mouth, especially with women, because women love to get together and talk. And so, someone will just say, I had that problem and I went to see, a pelvic physio. And then then people start to go online and do research, and that'll come up. We get people also, going to Dr. Google and starting to look up some of their symptoms, and it might be in a line in passing that pelvic health physio can help. And so then they'll start to look at that.
So, everybody is different. What kind of assessment do you do?
So the assessment is, it begins like any other sort of physiotherapy assessment that we would do for any other part of the body. We take a really detailed history of, what brought you into the clinic, what are your issues, what's going on. And then we do a full body assessment, musculoskeletal assessment. So we'll take a look at posture and how you're moving, because it can affect how you're moving. The pelvic floor is very integral in, your low back and what's happening in your back and your pelvis and your legs. So we'll take a look at that kind of stuff. And then from there, the big difference is that with a pelvic health assessment, we will often, with the patient consent, move to doing an internal exam of the pelvic floor musculature, either vaginally or rectally. And therein lies the difference in the assessment. And that I must just say one other thing, though, that we do treat males, females, and any age. So we do also treat children. So Jody does pelvic health in children. But within the child population, there is no internal exam. That's very different. It's more just the history taking, and there's a lot of education, and it's done with the family or the parents involved.
So that can be bladder control and issues like that, I would imagine.
Absolutely. With children, it's things like, delayed potty training and or issues with constipation, or there's something called giggle incontinence, where they laugh and they giggle so much that they have a leak, or they have some pain with having bowel movements. So that's sort of with children, that tends to be, or a lot of bedwetting that night for a longer period of time than would normally be expected.
So what kind of training do you need? Obviously you're a registered physiotherapist, but what kind of special training do you need?
Yeah, so what we do then is, as a registered physiotherapist, we take a lot of extra courses, postgraduate courses within that pelvic health realm. And there's a lot of different courses within that too, because we deal with so many different age groups, men, women, and then whether we're looking at a population more in oncology, like cancer-related patients, or whether we're dealing with more gastrointestinal, so bowel. So there's a lot of very specialized courses within the pelvic health subsection itself. And then what we do from there is we have to become rostered with our college, meaning that we have to establish that we are comfortable in performing and that we have the skill to perform an internal assessment, which is considered to be a controlled and authorized act. So then once we roster with the college, then anyone can sort of look at either to see that the physiotherapist has the right qualifications to do such an examination.
We live here on Earth, well, most of us do anyway, and I'm just wondering what effects, and this may sound weird, but gravity plays on being a physiotherapist and something like this, because when you think about it, we're standing up most times if we're not sitting down, and the gravity, the weight is pushing down. And does that affect the pelvic region? And maybe more people could have a lot of problems solved by talking to somebody like yourself?
Yeah, absolutely. So gravity, the pelvic floor muscles sit at the bottom of the pelvic rim of the basin of the bony structure. And the pelvic floor muscles have a number of functions. And so one of them is to maintain continence. The other one is to support all of our internal organs. So yes, when we're up and standing and gravity's pulling down and we have that we call intra-abdominal pressure coming down, that can load out the pelvic floor more. So there can be fatigue or tiredness within that pelvic floor. And that can cause problems such as in women a prolapse, where you're getting a bit of a descent of the internal organs. So that can be very common.
So what kind of, like you're talking about muscles and tendons and ligaments, and what would you direct somebody to as far as exercises, or like what's the most, I guess, common type of preventive treatment maybe to strengthen that up?
Sure. So that's a great question. And often, unfortunately, often people will just kind of do the go-to, oh, you know what, you've got an issue with your pelvic floor, you should go do some Kegels. So Kegels are pelvic floor muscle contractions. And that Kegels were developed by Dr. Kegel in the 1940s, who was a gynecologist at the time, who recognized that women post-birth were having weakness in their pelvic floor, and so he developed this program of strengthening the pelvic floor. And they're fantastic exercises, but what research has recently determined is that a lot of people, especially people who have pain, low back pain, hip pain, or pelvic pain, it's not so much that they have a weakness of their pelvic floor, but just like any other muscle in the body, they can also have an overactive pelvic floor, or pelvic floor that has too much tension in it. And then it's not so much that they need strengthening in Kegels. And actually, if you give someone who has an overactive pelvic floor Kegel exercises, you give them strengthening exercise, you could make their symptoms a lot worse. And this is why it's so important to do it's the gold standard to do the internal exam, is to really get a good, clear picture. Does this person have an overactive, tight pelvic floor, or do they really have a weak pelvic floor? And if they have an overactive pelvic floor, then we're really looking at trying to calm down that pelvic floor, desensitize, take the stress and tension out of it, and then determine, okay, is it okay now, or is there an underlying weakness, and then go into doing the Kegels or the strengthening exercises for the pelvic floor.
Well, somebody recommended that I go Kegling. I showed up at the bowling alley not realizing the difference between Kegling and Kegling. So, that just shows you the importance of education.
Yeah, and actually, it's funny because oftentimes what we'll have with the doctors say, you know what, you just go do some Kegels. And actually, 40% of people who are told to do Kegels do them incorrectly. So it is really, you need to be taught how to do it properly if that's the right direction to be going with treatment, for sure.
I would be better going bowling than probably anyway. Probably safer for my body, I would think. Well, listen,
I'm going to have a day of images now. Of
sorry about that, Scott. I should have warned you.
We're not going bowling, buddy. We're not going bowling. We're not going. I'm just saying.
No. Boy, is he bowls strangely. Oh, well. Listen, if someone is interested in getting a hold of you, and maybe we struck a note with someone out there going, you know what, I bet you that could probably help me out. How can they get a hold of you guys?
Yeah, well, absolutely. People are welcome to take a look at our website, Uxbridge Physiotherapy, and we've got information there. The other way is, call the clinic if you want to speak to me or Jody directly and have some questions or concerns. We're always happy to discuss it over the phone to see if it is appropriate or not. The other option is there's another website called Pelvic Health Solutions, and they have a ton of information on that website, as well as a list of find a pelvic health physio. So you can go onto their website and look at your area on a map to see if there's somebody closer to you that practices pelvic health physiotherapy.
Well, it's been great talking to you this morning. We want to thank you for your time. It is a great program, and you got two people I know on the line here that went, "What the heck is pelvic health?" And I think we get a better idea now after speaking with you. Again, thanks for your time.
Well, my pleasure, and I really thank you very much for having me on the show today.
That is Nicole Igel, registered physiotherapist at Uxbridge Physiotherapy. And there's Scott Campsall as well from Okami Kai, who apparently will never bowl with me. That's
No.
Sorry.
I'm already worried about the nightmares.
Exactly. And unfortunately, you can't shower your brain. Otherwise, you get rid of that image. So I do apologize. But try and have yourself a great rest of the day, Scott. And again, Nicole, thanks for your time.
Thank you.
Have a great day.
Take care. Bye-bye.
Bye.
Wellness Wednesday today brought to you by Uxbridge Physiotherapy.